value system calm. It's probably very different than what all of you do to stay calm.
Yeah. Yeah.
Unfortunately, not everyone likes to knit.
Next one, asking questions, understand instructions from the teacher. Like the critical.
So good afternoon, everyone. We're going to give just another minute to allow folks to join us, and then we'll get started. Okay, so it's just a few minutes after the start time. I think we'll get going. So thank you so much, everyone, for joining us. I'm going to read just a little housekeeping, so I'm sorry if I'm not checking in there on the screen with you. So thank you for joining the PeerTAC workshop, working with peer-led and family organizations, presented to you by the Wellness Collaborative of New York IPA Partners and Families Together in New York at the inaugural Supervision Summit. I'm Rebecca Evansky. I'll be the facilitator and the moderator for your session this afternoon. Your microphones should be muted. Please raise your hand to signal a question, which we welcome and hope you will share questions with us. Feel free to turn your camera off if you prefer to eliminate background noise and distractions. And we encourage you to use the chat box to not only introduce yourself, but share questions along the way. The session is being recorded, and a link to the recording, slides, and any handouts associated will be posted on the PeerTAC website within the next 30 days. If you lose your connection or accidentally leave the room, please join us again. Just open your program and select the link next to Workshop 7. If you're seeking CE credits for this session, you unfortunately can't use a phone link. You'll have to sign in through Zoom. 10 minutes will be reserved at the end of our session for questions again, and you'll receive instructions by email from the Alliance for Rights and Recovery for completing the workshop evaluation. We encourage you to complete the evaluation. Let us all know how we did. If you'd like more information or if there's something you wished we had talked about, we can certainly bring that to you in our next session. So now I will kick us off for our presentation today. So you've got a very expert panel with you this afternoon working with peer and family run organizations, and we have all of the areas represented. So you'll hear from them and get a little bit of introduction information from them as well. We hope that maybe you might be joining us fresh for this part 2, but if you were on part 1 as well, that's great. So you have myself, Aviva is here with us from HALI, Taina from Baltic, Jeremy's with us from People USA, Tammy up in our North Country at Step by Step. We've got Meghann and TJ from Families Together. So today you'll learn about connecting and collaborating with peer-led and peer providers across New York State. Certainly understand ways to connect and contact us as a peer provider expert to better support individuals that you're working with maybe in their wellness journey, and explore those opportunities to improve peer supervision and support as professionals in your organization. Okay, so highlights, some of the great stuff that we talked about last week, just in case you missed it. I think a key piece was that fostering collaboration. That's why we're here today, why you're spending Friday afternoon with us. Thank you, everyone. With a peer-led or family youth peer organization, you get to know who they are through these discussions and connect with your leadership team. So if you're a leader, connect with us as a supervisor or director of a program to get better information and allow that peer program to grow. If you're a peer on the line with us today, I've continued to encourage this in every session that I've talked about. Connect with other peers. I always say, don't play that reality show Survivor out there trying to make it happen all on your own. We have great learning communities, ways to connect with individuals across New York State. So reach out to someone and connect with them so that you can feel supported in your role. Ask those questions, connect with others. We want to learn from each other. We don't want to reinvent the wheel. We want to share those experiences. That is really what this peer work is all about. We feel like nurturing peer growth within organizations is a key piece of why we're doing this work. So we also can't operate as peer-led providers in an island. We need to connect with your community-based organizations because we certainly know there are individuals out there who have no idea this exists and that they could utilize the support of a peer professional in any capacity. So making sure that if you're a leader, you can engage your multidisciplinary teams to better understand what the peer work is and how to best utilize that skill set. Those accommodation roles and responsibilities, we talked a little bit about that last week. And I just want to say they are really the same for all members of your organization, not just the peer provider network. I'll say that again, your accommodations, your roles, and your responsibilities are same across your entire organization. When you consider a job description, when you consider self-care or benefits and resources, it's really the same for everyone. And that's actually what leads to that nurturing workplace environment. So that's very similar. Nothing changes because you hired a peer. You're going to collaborate with them the same way as part of your team as you would with any other member of your team. Multidisciplinary team approach. So all of those voices at the table should actually have a voice at the table, keeping in mind that the peer helps to bridge that gap in providing that unique experience. And certainly we learned who to call upon. You're going to hear from your leaders today in the peer field. So understanding that difference between, do I call upon a peer-led organization? Are there individuals at my place that need to connect with someone one-to-one versus do I have family members really seeing challenges? I should connect with a family provider or maybe a youth peer advocate. All of those were shared, and I know they're going to share their perspective again today. So finally, that nice little block there sums it all together because we considered the research last week around the fact that peer support improves the quality of life. It certainly increases and improves the engagement with services in general and leads to that additional health and wellness, and certainly increases that confidence in self-management. And we have the research behind that. We shared it last week, but if you'd love to hear about that more, we certainly can share it with you. So now we'll look at today's agenda. We're going to be considering the unique needs for your population. So big emphasis on, are we screening? Are we understanding what individuals need who we are serving so that we can best connect them with that right level of expertise? That communication and teamwork, a little bit more of a deeper dive around that fostering of collaboration, certainly recruitment and supervision. So taking the, I hired a peer, we're building a peer program to the next level. How do we really recruit, retain, and supervise them in a way that is going to facilitate and grow your program? And then certainly identifying in a dual role and that self-assessment. So I'm going to turn it over to Aviva now, if you'll share a little bit of an introduction, since you noticed I didn't do that for everyone. Tell us a little bit about you, your organization, what you provide, and you can kick us off.
Sure. Thank you, Rebecca. Thanks everyone for being here. My name is Aviva. I'm the Chief Strategy Officer at Hands Across Long Island, otherwise known as HALI, and we are a peer-run agency in Central Islip, Long Island. We've been around since 1988 and provide a whole slew of peer-delivered services, housing, forensic bridging, support for individuals facing homelessness, recovery center, physical wellness support, among others. As a peer-run organization, one of the things that we've often been approached about is how can we support our peers? How can we do a better job of implementing as a non-peer organization? How can we better understand the role of peers? Can you provide some help, some guidance on that? Sometimes that comes in the form of actually placing our peers in those other settings. But for now, I'm going to focus on some of the other ways that we've supported those non-peer run agencies in better understanding the role and implementing it. And I think sort of the takeaway of what I'm going to talk about is just that it's different for every agency. The needs are different. Organizational assessment is a really important tool. It's where you start to better understand what those strengths are that are already held by the agency and where they can improve, better identifying how we can be supportive in providing some of that guidance. So once that's done, and again, that can take the form of conversations, focus groups, specific assessment tools, interviews, but depending on the needs that are identified in that process, we may offer guidance around recruitment. That can be review of job descriptions for the peer roles. It can be screening the candidates, review of resumes, appropriate interview questions. That can be a tricky one sometimes. Another service that we offer is co-supervision of peers by experienced peer supervisors. So they may have a task supervisor, someone for that more of that administrative day-to-day oversight on site. And then we'll provide sometimes monthly or more, depending again on the needs of the organization. We'll provide more of that supervision to kind of dive more deeply into is the work that you're doing aligning with the peer values? What are some of the challenges you're experiencing? How is it feeling to be a peer in a non-peer run agency? We may also do some implementation support or technical assistance, sometimes sessions before peers are even hired to help non-peer staff better understand what to expect, how they can collaborate effectively. We'll address things like role clarity, cross-disciplinary collaboration, and ensuring that the fidelity of the model is preserved throughout those services. So these are all examples, again, of things that HALI is already doing, but it's not an exclusive list. There are many more things that we could do. And again, we really like to tailor it to the specific agency's needs. And I think that's really what's most important, is being able to identify those needs right off the bat and support in a more individualized way.
Thank you, Aviva.
You're welcome.
So the next piece of the deep dive here is fostering that supportive culture. So looking at communication, I'm going to look to my IPA provider team and others, certainly if you have questions or want to chime in. From that peer-led perspective, we look to you to foster that supportive culture. So if my partners want to share experiences around potential communication, thinking about how we want to share with our other organizations or even clinical providers, how we carve out this communication time to make it effective and meaningful for the peer program. Any ideas?
I'll take a stab at it. Hi, everyone. I'm Taina Laing, Chief Executive Officer of Baltic Street. Nice to see you all. So fostering a supportive culture, I want to say that one of the things that I find it to be really, really effective is to ensuring that the client is the driver of their recovery. And so, often too many times when a client has dealt with a lot of effects with different types of systems, that we often want to be the solution focus of what the client's needs are. And that's where we really need to start off as, right? We really need to start off where the person wants, right? What we think that they need may not be what they feel that they need. And, having an opportunity that with the peer included in the conversation to support the person through that recovery process, right? I think that we all want the same thing, is for the goal for whatever that person wants to reach, right? So ensuring that there's clear partnership, clear communication, clear that we're not all doing the same kind of work for the individual, right? Because often too many times teams get into the space that everybody is working, doing the same thing. Does that make sense? Like, if you're going to go to the benefits office, that you don't have the case manager and the peer going to the benefits office, that they're included in the team meetings, for the collaborative piece, right, for that participant. So, and it's going to be always like, like people are in the middle of evolutions of their recovery. So are their treatment plans, right? And whatever their goals are, today their goal might be one thing, and then it might change next week, and understand that there's got to be flexibility in that. So, as long as the lines of communications are open, I think that you really will see the best engagement from the individual and the best outcomes at the end.
I love that. And I think just hitting on a few things, hearing that clear, transparent communication, not only between the peer-to-peer, but within that team organization, knowing, are we providing what the client needs, or are three of us all trying to do the same thing? That doesn't work either. It can feel overwhelming. Leads us right into the teamwork too. So I'm wondering if any of my partners would be willing to share maybe your best practices or your go-to things for two areas of teamwork, because Taina touched on that with peer-to-peer, but how do we promote the peer profession? I think I've heard that a lot as part of the theme. So if you are either, even as a peer-led provider, which our experts are coming from that perspective, giving the view to our clinical providers who are joining us in this work, how do we best promote peers within our organization? What might that look like?
I have a thought on that, Rebecca. I think, one of the things that often gets associated with cross-disciplinary collaboration or teamwork is, okay, we're all coming together and there's this sort of blurring of the lines. We're all sort of this giant group, and we're expected to be working toward the same thing. And ultimately, we are working toward the same thing. We're supporting an individual with whatever their needs may be. But at the same time, I think what makes that team even stronger is preserving the real clarity of individual roles on that team. I've always used sort of the example of like a jigsaw puzzle, right? And you have all these uniquely shaped pieces that come together and create this beautiful image, but they're not the same pieces. They're all needed to create that sort of unified view. And I think that's very similar to how an effective team with peers works. They're not coming to do the same work as a clinician. A clinician isn't coming to do the same work as a peer, but they both sort of need to work together and serve in more of a complementary sort of relationship to be able to bring to the team what is unique about their roles. And I think that's really key to effective teamwork.
I was going to chime in. What I believe works is when not only the peers, but the doctors or the clinicians or whoever, when they come to the table and have this cross communication, is that I think communication needs to be made as professionals, but we're people. And I think when lost with your degree or your status might hinder some type of that communication if one believes they might know more than the other. Both sides have to be willing to and wanting to share information, and that way you can, piggybacking off of Ms. Cohen, that it would come together as a solid structure to develop more positive teamwork, and you can team build because your people coming in, you're not your degrees or your position coming in, and that way with the different pieces coming together with the jigsaw reference, you're gonna get there a lot faster because that means you're open to the experience, you're open to each other, and you're open to what's working, what's not, and it won't be based upon what part of the department you sit in because you all share a common goal. You're people with a common goal to help this particular family of persons.
Yeah. I'm just gonna tie into what Taina was saying about how everything she said, we could put that right when peers come in to an agency, a clinical agency, and that we could use those pieces that she spoke about to welcome them on. Just as we're fostering a supportive culture for the person we're serving, we're also if you're thinking about adding new stuff, that's a new person coming in to foster that supportive culture in the same way for the peer. And especially, communication and teamwork with everyone and the relationship building. And when Aviva was talking about roles, they're really important. And it's also about what your staff will need as well, to help their clients. We call them our peers, but clinicians will call them clients. So they can help their clients be at most successful. So maybe it's transportation, and some of the clinicians on here today may think, well, yeah, but I thought peers weren't supposed to just be taxi drivers, which we are not. But to help your staff understand that a lot of things happen during that transportation between a peer provider and a person that's receiving services, that your staff know we're just not giving a ride. There's a purpose. We're providing the peer support. We're supporting them maybe when they go to apply for SNAP benefits for the first time or go to that Social Security appointment. We sometimes are the best people to provide those services because we've most likely walked that walk before. We're the experts in that in navigating the system. So know the importance of the peer if that's what you are missing in your agency, and that's what you know, is needed when you do an agency assessment.
Yeah.
I was going to jump in, and I think everyone's made some really excellent points, and I'm sort of sitting here thinking, well, what direction do I want to go? Because there's so many directions this conversation can go in. But what I'm really sort of, what keeps coming back to me as I'm sitting here listening to everyone is, you know, for however many years now, we've been using that term of lived experience to describe, you know, what we've been through. And more recently, a term that's been kind of catching on, which I think is really what we should be moving towards more often, is that idea of lived expertise. So it's not just, this is what we've been through, this is what we've recovered from, this is what we've survived, right? It's about, this is the skill set that we have built, which we have practiced, you know, which we have perfected, and which we are able to use to help bring that recovery to other people, right? So when you're talking about teamwork and working with people of different kinds of backgrounds, you know, it's you really want to look at what is the lived expertise that we are bringing as peer specialists, and how can we use that lived expertise, you know, both to help others to be able to best do their jobs, but also to, you know, help others understand, you know, kind of what is the role of the peer specialist. There's a few things that I would say peer specialists in general tend to be experts at. Probably the one that I think is really relevant to providers of all different types, however, is engagement, right? Peer specialists are experts in engagement. And, you know, like Tammy was talking about how, you know, peer specialists aren't drivers, right? However, if you are in a car with someone, it does provide an excellent opportunity to engage with them, right? And so peer specialists are so good at finding, you know, what's the opportunity? Where's that moment where I can form a connection with another person? You know, and I didn't introduce myself, I'm sorry. I'm Jeremy Reuling. I'm the program coordinator for the Yonkers Mobile Crisis Response Team at People USA. So I got that out of the way. I'm a peer specialist. I'm also a social worker. And, you know, the interesting thing about both of those roles is that engagement piece is really necessary, whether you're a peer specialist or a social worker. But I know a lot of social workers who kind of struggle with figuring out, like, how do you engage effectively with someone? Because sometimes that clinical role, that clinical environment, even just the pressure that both sides might feel around that title can be a barrier to engagement. And so sometimes what I've seen in multidisciplinary teams is that the clinical providers, once they begin to understand that the peer specialist is someone who has expertise in that engagement, that they're actually able to take some cues and learn how to improve their own engagement, not based on the training they have, which is considerable and which is important, but rather to improve their own ability to engage based on learning from the way a peer specialist approaches it.
Wow, Jeremy, what a perfect segue, because all of what you hit on, and one of the things that struck me and I made a note on is that peers have the expertise in understanding where and when they can naturally make that connection. So if it is in a basic ride share, meaning I can get you from here to there because the appointment is really meaningful, but I'm going to now use this natural vector that is non-clinical, that is comfortable, that, you know, there's even research. I started thinking there's even research around when you're either walking with someone or driving and you're not having to make that eye contact, how naturally engagement occurs, where in a clinical model, you think sit face to face, there's all methods around positioning your body language. But in that driving or in that walking stance, sometimes in a peer-to-peer relationship, that engagement happens naturally and leads us right into relationship building. So really the question I brought for the panel, and you've all really talked about, I'm not sure how we can elaborate on it or how I can shift this a little bit, is how do we best build that relationship, right? That expertise, but maybe it's not necessarily with a peer. We all talked a little bit about that. How do we build that relationship between maybe peer and supervisor, or maybe peer and multidisciplinary team? If anyone has ideas around that, because I think we continue to hear that as a challenge, and it certainly lends itself to supportive culture. Any ideas on that one?
I have an idea about relationship building is, just asking questions of one another. When Jeremy was speaking, I was thinking about, back to the role thing, like, and how we engage, and not only how do we engage ourselves, but how do we keep people engaged in services. And I have no word for it, or no term, but I don't know how many times I've said, when providing peer support or taking a ride, or giving a ride, or working in the garden or whatever with someone else, and they've discovered something about themselves. And I said, and bingo, that's what you have to go talk to your therapist about. So back in, if anybody remembers the beginnings, like it was an us and them. It was the peers and it was clinicians. When I had left and finished my college degree, and when I returned, it was completely different with my work group, and with the people that we contracted with the psychiatric centers, and they're calling us up and saying, Tammy, how do I get, how do I tell this person how to apply for Social Security benefits? How do I go about getting them to be their own payee? Maybe they're a new therapist, or who do I talk to, or they've tried this. What do you suggest? So now we have clinicians calling us for that great, thank you word, Jeremy, expertise, so they know. We've been with our contractor for over 25 years. So, even with turnover and retirements and everything, it's been a very strong relationship. So I'm grateful for that. And I think that we've done a lot of good work together as a team. So I just ask questions like, what do you do? What's your expertise? What kind of, and don't be afraid, to ask something that you think is a stupid question. Either the peer or the clinician, just learn about each other.
Tammy, I love that. Oh, sorry. Go ahead, TJ.
No, you were starting.
So Tammy, I love what you mentioned about asking questions, and I think that can be really important in the supervisory relationship too, because there's sort of this assumption that the supervisor is coming in with more experience and knowledge and wisdom, and as a teacher, as a mentor, as someone to share, who's going to be sharing that. And that's all true to a certain extent, but there's also a different set of knowledge that, like we were saying, you come in with as a peer who has lived expertise. And I think being able to ask those questions, like you mentioned, as a supervisor of the peer, in a way that does demonstrate some humility and some curiosity, and gives the peer the opportunity to share those unique experiences, can be really valuable. It shows that you recognize their experience as an asset, and that you really do want to know, that you're invested in that experience and expertise and what it brings to the table. While asking those questions, it's also important to not assume that because this peer had this experience, it applies to all people who've struggled with mental health or whatever the challenge may be, right? So not sort of making them the token mental health person, but saying, I'm curious, what's worked for you that we might be able to try with this person, or what's some stuff, that based on your experience might be useful to consider. Anything you think I should know, right? So being really open to learning from the peer and that unique perspective from lived expertise.
That's excellent, because then, if you have more than one peer that you're supervising, you're going to learn what their expertise is for each one. And that's what we do. We have someone, individual that has this struggle, then we will pair them and And a supervisor can do the same once they learn about each individual peer provider, peer specialist. Great, thank you for pointing that out because I wasn't thinking that way.
I wanted to just jump in really quickly and, thinking about that role of the supervisor and both what Tammy and Aviva are saying, it's such a to me actually as a supervisor is really like a freeing thing when I realized that I didn't have to, feel like just because I'm the supervisor that I am the expert in everything, right? So that whole quality of peer specialists around mutuality, that's something that can exist in a supervisory relationship as well. It doesn't mean that everything's, exactly, equal on all levels, right? As a supervisor, you're necessarily going to end up having, more power, right? You have the ability to write evaluations and to, you know, do work assignments, right? And so you do have a certain amount of power. So it's, that has to be recognized. But you can also be open as a supervisor to learning from the person that you are supervising. And I'll never forget one of the first people I ever supervised when I was still sort of very new to working within a peer service. I remember how he used to challenge me during these supervision sessions and share with me, different kinds of experiences that he'd been through that I wasn't really able to relate to. But when I stopped, and not that I couldn't relate to it like on a human level, but I couldn't relate to it in terms of it wasn't something I had ever experienced, right? And only when I sort of said, I need to listen and see what can I learn and how can the experiences I'm learning from this person actually make me a better supervisor, both for him and for others, right? To make sure that those conversations are going both ways, that people who are being supervised still have choices, have abilities to contribute. And sometimes they're going to bring in an expertise that you just don't have. It might even not be about, lived experience as we think about. It might be that you're supervising someone who worked in another field before, and they have experiences and skills they've learned from that field that we haven't learned in ours. And maybe that's something that can help us. So having that openness as a supervisor, not just to say like, I'm in charge, I'm the teacher, but also to actually be the learner, to be able to sometimes find ways to share some of that power can really be, it can be really great for building, the overall team and the overall relationship.
I'm just going to quickly chime in with what Jeremy was saying as well. Supportive supervision is actually one of the best tools you can utilize with a peer. Baltic Street, this is what we work on. We've always led with, you all know Dr. Jonathan Edwards, his 5, supervisory functions, which I think that everybody, please go check it out. Dr. Peggy Swarbrick was talking about it today. You have to be able to cultivate a culture that is supervision is not punitive, but supportive, that supervision is a space where we can find the areas where we can prevent early burnout, because as we all know that individuals in the peer workforce, might, depending on obviously case by case, might experience vicarious trauma. And of course, if you have supportive supervisions, these can be the stopgaps to that, right? So how can you communicate in a way where it's in favor of the support, right? So always keep that in mind as well.
TJ, did you want to jump in? I just didn't want to miss your point before we move on.
I think, everyone kind of hit it on the head pretty much as to how I was going to just say, as being a supervisor before and, being supervised now, what there's two things, well, a couple of things that seem to work. So the individual supervision, right? You're getting to, at the beginning, the the supervisee is the one who's being, who gets the chance to ask questions and whatnot. What tends to work with a few supervisors I've seen, and I've seen it across the board that seems to work, but not necessarily becoming friends, but we give ourselves a few moments beforehand to talk about anything outside of what we're doing, and it builds a humanistic relationship just to see where everybody is, right? And then, once we kind of get a feel for, okay, cool, this is out the window, I think it opens the door for a relaxed and honest conversation. So if your supervisor is, especially who might not have had a lived experience, there's always a way to drive it in a way where they will be able to see what it is in your shoes. If they have a non-biased approach, right? So they're going to ask the right questions, or you start off asking them questions and then throw them in a scenario, and then you could tie it into the family that you're working with, right? So that's an individual that kind of works with me. Is when I was a supervisor, what's working for you, what's not working for you. If you've been in the system now for some sort of time on this driver's seat and this driver's seat, now what would it look like if you had a chance to make changes or help a family in a particular light, right? So you're giving them a driver's seat to explore something that you might not have been able to, but by seeing how they're able to map out the ins and out, the pros and cons, and the ways that they are working with their families that seems to be working, we can begin to develop or like take note and kind of like explore this with the team now. So now the following week you have a team supervision. You spoke to everybody individually. You get a group visual and understanding. And since you guys are already building that rapport, you already have a rapport just being in that team in itself, having your supervision therapy, it fosters a relationship where you would be on an equal page in understanding your role and still being able to develop comfortably, as opposed to feeling that you're not being heard because of your degree or title, things along that nature. So humanistic approach is always, for me, I feel is the best way. I think is the best way to foster a supportive culture.
I love that, TJ. I'm so glad you spoke up. Just adding even to what Jeremy had said in that finding, that relationship building, we need to add that humanistic relationship building, because at the end of the day, that's what we are. It takes it outside of even that peer work, which is allowing us to be human and have those rapport building conversations, especially if it's a non-peer supervisor role. So one more on this supportive culture, self-assessment. I can't leave this discussion without asking, what would be some of our experts go to for organizations who are wanting to either do peer support better or start peer support? What should they be considering? How do I know what the individual needs at my organization? Should we be using some sort of tool? Should we be asking questions of our team members? I'm going to let you take it from here, because I think we've had a little discussion on this, but I want to dig into what should organizations do as that first step self-assessment before saying, okay, we need to hire a team of peers. We know engagement works. We know this is how we can build better relationships, but we have to figure out what are the needs of our organization. What should folks do?
There are some great tools that exist out there, but rather than sort of focusing on the what for now, I just want to make one point about the how, and that's that I think in doing kind of any self-assessment organizationally, specifically around a new role or a role that people might not be familiar with, it's important to make sure that all team members are a part of that process, not just leadership, not just direct care staff. I think often it may seem like, oh, we're on board, we've got this, we really want peers. But that's not necessarily the attitude that you'll find across the board. And it's really important to have that buy-in across all roles, not just top or bottom or whatever, really making sure that you're getting all those diverse perspectives when creating a better sense of what the needs are and what the strengths are.
Fantastic point to launch us out, because certainly even in the PeerTAC initiative with Motors clinics, I think we're going to a ground level of, well, the regs are out, now we can bill. now what, right? Without having that discussion. So great point, Aviva. Let's build on that too, because yes, there are lots of tools that exist, but how do we, taking that a step further, and what are we looking for in talking with our team members? I stumped my panel. I didn't mean to do that, because I know it's late on a Friday, but when I was thinking of building this discussion around even the self-assessment, I had put link to our peer professional providers. So hearing what Aviva said about the buy-in of the team, let's say you're any community-based nonprofit organization saying, hey, we hear peer support works. If you're the Motors Clinic saying, hey, we can now bill, and you're doing your team assessment, you're talking to your clinicians, you're talking to your care managers, you're talking to all levels of that team and saying, I think we're going to do this. Or maybe just leadership are having the conversation, which we know happens a lot of the time. Like, we should launch this. How about then, can we engage with one of our peer-led providers? I mean, how many, I know all of my members, we've been promoting that. Come and have a conversation with us about what this looks like and how to do it well. Does that make sense to my panel?
Yes.
Yes.
So I was going to say, I think there's actually, for an organization, I think there's a lot of power in sort of being able to say that you don't know, right? And because as soon as you say you know everything, as soon as you say, oh, I've got this thing that's new to me that I've never actually had a chance to do, you're really limiting your opportunities for growth, and you're limiting your ability to become strong in a new area. So I think for organizations to really, if they're new to peer support, to be able to say, we don't know what we don't know. And who does know this, right? So where are there organizations that are very experienced with peer support? I work for People USA, right? So People USA has been doing peer run services for about 30 something years at this point. Other Baltic Street, right? They've been doing it for a long time. HALI, they've been doing it for a long time. There's many agencies that have really I mean, I won't say perfected, because you can never truly perfect it, but there's many organizations that have learned how to provide extremely, extremely good peer support services. And if you're new to the game, that's okay. You go, you talk to the more experienced organizations, maybe you set up some supervisory channels, maybe you set up some consulting channels, maybe you have, regular calls with peer leaders who can assist you in looking at how you're providing services. And I think one big, big area for growth right now that I've seen is, and I'm not the expert on this, but I know we have experts on this panel on this, are the youth and family peers, right? Because as the whole peer support field sort of got going, it, not that it didn't totally exclude families and youth, but it really was more focused, I think, in the adult world. And now there's, a really big push to bring more peer services to youth and more peer services to family. And the family peer advocates is something that's growing, and the youth peer advocates is something that's growing. But the organizations that have been more traditionally focused on children's services or family services, those organizations have more catch up to do, from what I've seen, in terms of being able to offer peer services. And so for me, I think there's so much that the family organizations have to learn, and so many opportunities to really learn, how do you bring peer services into children's services or family services?
I just want to hop in really quickly in this as well. Let's not forget also justice impacted individuals and individuals that are the aging older adults as well, right? Because often too many times we have individuals that all of a sudden they hit a certain age bracket, and now it's, oh no, you go here. let's not silo these groups of individuals, and let's transition into what peer adult life looks like after 65 and older, right?
Mm.
You know, now we're going to start looking at what medications, you know, can look like, or maybe some effects may look like to the medical world, right? I mean, I can't even tell you how many times I've had, you know, individuals tell me, well, you know, my mother just had, you know, a UTI, but it looked like she was going through her symptoms, and that's not so. So educating, you know, families to support their aging parent that may have a dual diagnosis or a diagnosis. So again, you know, there's different areas that peers definitely can contribute such an amazing factor, you know, and especially, I mean, when I came into this business, I didn't know that I was a youth peer advocate, right? It's amazing. I'm like, wow, I actually started as a youth peer. So, you know, embracing the youth peer, and I keep talking, I mean, Kathy Kent, who is absolutely amazing over at OMH, you know, gave me a wonderful life lesson that we are expecting for the youth to be professionalized when they're very early onsets in their own trauma. So if you are going to be supervising the youth, right, you also have to find a supervisor that is willing to be a mentor to this young person, right, to this youth peer. So mentorship is key, but I not only for a person who is a youth, but I also see how mentorship can shape an individual in this peer workforce if they've never worked before, right? So how can we really be that fostering group of individuals that we can say, this is what you want to do, there is a career ladder here, right? So really offering those type of supports as well. So I just, you know, it could become a really beautiful marriage with the buy-in, as what Aviva was saying. So you can see how it all interconnects. You know, it really is it's a beautiful field to work in, because it does come from a space where we really want to see people, you know, grow and flourish in whatever their, you know, their recovery, you know, journey is, you know, and it all starts with community. So
Yeah, really great points. So we covered a lot there in the self-assessment. Thank you, everyone. And we'll still have some time for questions as well. So I felt like this came up so much throughout the theme, not only of this summit, but in our learning collaborative with clinics, in all of the peer work we do. We're hearing recruiting, supervising, recruiting and supervising. We hit a little bit on that supervising today. What was so interesting to me, and I want to hear from our panelists, right? That when Liz opened us this morning, Liz Breyer, OMH, she had talked about and shared statistics around the Great Resignation, which I have heard of. I think, you know, I'm seeing some head nods. We heard about it because we don't function only, I imagine, everyone. I know some of you better than others, and I know we don't function in a silo of just our peer world. So we have friends, we have family who are educators, who are in manufacturing, who are out in the business world and in marketing. And I'm going to tell you, the Great Resignation was real. People got sick of doing the day-to-day, being out in the field, or when they were asked to come back to something they really didn't love, they didn't want to do it anymore. And then they found out, I don't have to do this. Maybe I'll find something else that hits my passion. And Liz's, I should have told her I was going to do this and give her a heads up. But Liz, when she opened that discussion, it made me giggle, because I was like, of course she didn't know about that in the peer world, because everyone, we love our work. We have a passion for it that is very different from manufacturing and marketing and retail and business. And everybody's laughing like, yep, we found it. We're here. We're in it. You're hearing Jeremy and Taina and Aviva and Tammy. If I had asked them to open with how many years they've been doing this work, and then maybe share a word of their passion, that'll be for our next panel, guys. You would be as astounded as I am, because I know those stats. So guys, how do we do this? How do we recruit? And I'll throw a little like retain. What are your best organizational, from your perspective, practices that you can share with everyone today?
So I'll kick it off. One of the best ways for recruitment is the individual that you actually served. That is your number one. Remember the Rogaine commercial, For Us By Us? That is literally the best thing that you can ever do for a person, that I come from a long history of employment here at Baltic. And I mean, employment is my passion, supported employment is my passion. I truly believe that anybody can work. I truly believe in my heart of hearts that any person that walks in through that door that is seeking services, that if you give them the right amount of support and care, that person would be your best asset in your future workforce. Absolutely. And that cultivates so many nuances for the next wave and the next generation that keeps on coming, if that makes sense. I have people that have started in my employment program here at Baltic Street that are working for Baltic Street now, 15 years plus, easy. They were, this organization started at the psych unit, right? When they got their little $99,000 grant, you know, it started with 5 peers that came from South Beach, right? Because who better offer the peer service but the individual that actually received the service? So I'm telling you that is good, that is stellar. And how you retain it is by really, really offering good quality care back, showing your employees that you really care for them, right? Making sure that they have good life insurance, right? Me and Rebecca talked about this. You know, my goal is to one day making sure that, you know, we have a match 403B, right? Because retirement really does have to be the next conversation. Not about benefits, but real retirement, right? Making sure that there's health insurance offered to your people that's either affordable or free. Proud that Baltic Street is able to do that for their team, right? That you have adequate enough vacation times, right? PTO time. Like, I mean, that, you know, how do you tell people that we care about you, right? And this is just anybody, right? Not just a peer workforce, but just anybody, right? Just want to make sure we're clear about that too. You know, it's across the board, right? And ensuring that, you know, that there are wellness days in there, right? Like sprinkle a couple of wellness days, because if you're with or without a diagnosis, we all get stressed. We all can agree to that, right? That you're being taken care of, and ensuring that, you know, you're cultivating a culture of care, right?
Yeah.
That you care for your team. So that's what I believe in.
Great kickoff. Love it.
I'd like to mention something so for years we were so small, we couldn't do the retirement, and we couldn't do the benefits, even the medical benefits, but we did still keep to that support and care. And it's funny that Taina just said something about whether you're a peer or a non-peer, because I was reflecting back when Meghann, I hate to call you out, Meghann, you shared last week about that employer that didn't understand your trigger. Now, if it wasn't that because you were a peer, you know, if that happened to someone that I was supervising, that type of thing, someone, you know, that would be emotionally, you know, traumatizing to any person, whether it was the most sane person or that's what I would say is, like, just support things like that, because, you know, your situation was not because you were a peer that you needed that type of accommodation. Anybody would have needed that. You know, the most sane person that would have, you know, had an effect on. So that's where that support and care comes from. And we've lost, you know, I've seen people leave the peer world, you know, as being a provider, because they didn't have good supervisors. They didn't work for an agency that understood. Quickly back to the communication and how to retain people is, I was at a conference just recently, and someone shared with me, I was in other workshops with her. So I know that she had, you know, she knew her boundaries. She was, you know, attentive listener. She was a good peer. She's a very strong advocate. And then when we got to the one workshop, we were talking about defining our roles as peers. And she mentioned that she was getting ready to leave because she had been with on a contract, the only person in that contract. She worked for an organization, only person in that institution, clinical setting, that was a peer. And she was just popped from one department to another department because none of the staff the staff wanted her stealing their job. She'd go in and play cards with someone. Nope, nope, I'm the activities person, not you. She'd go, help someone with lunch. Nope, I'm the dietitian, not you. So it was just, she was being bounced all over, and she's like, no, I'm looking at other jobs. I don't want to work in the peer world. So just, that's the other importance of the role definition is, so first of all, you don't want your clinical staff thinking that someone's there stealing their job. And secondly, we come to work for a purpose. That's why we stayed throughout COVID. So we want to feel like we're making a difference when we come to work.
One thing I heard, sorry, one thing I heard Taina touch on was this opportunity for growth and really investing in people and what their goals are. And I think the same applies not just for recruitment, but also for retention. So I think, I'm always a big proponent of creating those career ladders within peer roles, not just saying you can go and be something else. You can leave and go back to school. You can become a social worker, a clinician, whatever. And that's not to say those aren't paths that someone may want to take, but they shouldn't be forced to take them for a lack of opportunity for growth or a career ladder. So creating more supervisory and leadership roles that are peer roles and providing people with the tools, with the training, the supervision, the professional development opportunities to be able to succeed in those roles is really important as well. I think so many people leave because they hit a dead end. I've been doing this for years. What's next? I'm making the same salary I made as an entry-level peer, or, I'm still seen just as plain old peer. I haven't been able to supervise anyone or lead anything. So really giving people the chance to grow in their roles as peers is critical.
So I'm listening to everyone, and one thing that I feel like everyone's kind of touching on, but I want to say it like really, really directly, which is you can't treat peer specialists like cheap labor. That's a real problem still in many places, where the amount of money that is being paid to peer specialists is, it's borderline insulting. Not even borderline insulting, it is insulting. And I've seen a lot of peer specialists who are skilled and who like the work leave the work when they realize that they can make more money doing something a lot less stressful. I'm not going to name any specific careers, but that when they're making only, $15, $16, $17 an hour, and they're realizing they can make 25, 30 doing a lot of other kinds of work out there that don't necessarily have the same kind of vicarious trauma, don't have the same level of training necessarily needed, and where they have promotional opportunities. So it's so important what Aviva was saying about the career ladder. Like, there needs to be that career ladder for peer specialists as peer specialists. And there shouldn't be a pay differential, or at least there shouldn't be the same kind of pay differential that there is now between other kinds of professions in human services and peer specialists. Yes, I understand. And again, as I said before, I am a social worker, and I understand that, social workers went to grad school. I understand there's pay differentials that are across the whole workforce, not just in human services, for that kind of thing. However, if we're really talking about valuing what peer specialists bring, and if we're talking about lived expertise and understanding that their life history and their recovery history is something, that deserves to be recognized and potentially reimbursed as well. I understand sometimes grants are what they are, and sometimes the money is hard to find if you're an employer. But I would urge anyone who's looking to hire peers, who's looking to start new programs, find ways to get that pay scale up. Find ways for there to be more equity between peer specialists and other kinds of providers. Otherwise, you're going to have a revolving door.
Yeah, thank you. Great point, and I'm glad that you got to that point. Excellent. Excellent. So we are moving right along, and I do want to give some time for our family and our youth peer advocates to dig into their topics as well. TJ, will you take on this one for us? So a deeper dive on our family peer advocate perspective.
All right. So what we have to be aware of is that, especially in this family peer advocate role, a lot entails, and kind of was touched on, oh, you're just a peer advocate, how much work can it be? It's emotionally draining for a lot, especially if you're really invested in the work that you're doing and the families that you work with. So you deal with emotional burnout to the point where you're taking on, you don't even know who you are anymore, because you're just involved in your work life, have to meet deadlines, have to do A, B, and C, taking on the energies of the families that you're working with, and possibly doing some of the work when you shouldn't, because some of us are heroes or try to be heroes if we feel the family needs that extra support. So to keep in mind with that burnout, there's a high workload, especially my previous job, we had 25, 30 cases. Some are more available than not, but still it's a lot. Then you have to set up meetings, then you have to set up events, you have to clean those up, you have to reach out. So that workload, it makes it really complex, and you'll burn out. Lack of boundaries is another area where burnout is evident. Is once again, we might become too available. Our supervisor asks us to do something, and if we're new here or there's a chance for promotion, we'll keep saying we'll become the yes man, and sometimes you don't even get that reward that you're seeking, right? Or the boundaries of the families, because you think that their family situation is so dire that you allow them to call your work phone after hours, things along that nature. So burnout is definitely at the front door. And then limited resources, depending on the organization, what they're able to provide you, and that's trainings, or that's office with office supplies, or where to travel to the families if you need them. If your organization is lacking and you're trying to put in extra work, you're going to burn yourself out trying to help find avenues and going out of your own way to make ends meet with your caseload and with your personal life. Excuse me. So what's needed? What's needed is I was gonna say family peer advocates typically involve providing support, guidance, and advocacy services for families who are navigating the challenges of raising a child with special needs, mental health issues, or disabilities. While specific requirements may vary depending on the organization or program. So personal experience is needed. If you don't have any personal experience, it's harder for you. Perfect example, I had a friend, we had a conversation. I used to work with him on gang prevention, and we used to go travel to different schools. Long story short, um, the kids responded better to us than the police-led programs for gang prevention or the schools-led gang prevention. Why? We had the experience. We did the stuff that these kids are doing or about to do, and that was that peer support and understanding. And our job was to educate you, and whatever you do with this information, it's really up to you, right? It's the same with the families. We can give all the resources, but with our personal experience, we'll bridge that gap, and allows us to reach the families to help us, because we're also in a provider situation. It should also help bridge communication with the provider. So empathy and compassion is another area. Effective family peer advocacy possess strong sense of empathy and compassion. They understand the emotional challenges families may encounter, and offering non-judgmental support. Knowledge of support services and our roles. We should be knowledgeable. The organization should be giving us the knowledge to pastors and families, contingent on what is needed for the family or what the family is asking for. We definitely want to develop our communication skills, and we want to have that transfer over to the families we're working with. We want to be able to communicate with each other and the families that we serve. Advocacy skills. We, as providers, need to advocate for ourselves and teach that also to the families we're working with. Boundaries and self-care is definitely needed. We do workshops here with families together and other organizations for sure, but we must learn our boundaries and learn what self-care looks like. I actually developed a self-care one that's actually coming next month. But how do we take care of ourselves? How do we take that time to take care of you, to reintroduce you to you, that you are not so-and-so peer advocate, so-and-so doctor this. How is Meghann doing? Who is Meghann? What does Meghann want to do today? what does Meghann Hay do? Let's be reacquainted. We need that for ourselves to understand that who we are. We're living beings who we'll struggle too. And just because we're providers doesn't mean we don't need help. It doesn't mean we can't reach outside. Collaboration and networking. It's not just an organization. There should be partnerships around. Should be partnerships internally, externally. Should help the be smarter, work smarter, not harder situation. With effective collaboration and networking, we should be able to once again bridge those gaps, have effective communication, and be able to take care of ourselves. And importantly, continue learning, continue learning and professional development. Why? Times change, we change, our certifications, depending on where we are or what we need for the specific role, will run out. We don't want that to overlap because that's our job. Let's continue to learn because knowledge is power. Sorry to be corny. And why connect with a family peer advocate? The best reasons to connect with a family peer advocate is for invaluable support, understanding that they can offer. Family and peers have a first-hand experience navigating the challenges of raising a child with special needs, mental health issues, or disabilities, or family members. So they have shared experience. We want to connect for empowerment. Family peers can empower you to advocate for your child and navigate complex systems. And we can empower our peers to be able to do our jobs better in the roles that we are currently in and trying to aspire to. Have emotional support. If we have a good emotional supports for ourselves, we also project that to the families and our coworkers, right? Because it usually starts with one. If they're doing something, it can become a habit. If you talk about it, you live about it, you be about it, it will work in a positive light. Reduce isolation. Connecting people, especially families who are seeking help, they feel isolated. Sometimes even us as peer advocates, especially if we're the only one when we first start, it's an isolation. We don't want that. So let's build a network where they won't feel isolated, where they know there's places they can talk and feel safe. And hope and encouragement. Family peers can offer hope and encouragement by sharing stories of resilience and success. Seeing others who have faced similar challenges and come out stronger on the other side can be incredibly inspiring and uplifting.
TJ, excellent points. And I especially love, I had mentioned it earlier and we've all talked about it, that reducing that isolation as a peer professional. So find your people, right? And help to grow that within your personal network, but also your organization. And Meghann, please share and introduce yourself. We want that youth peer perspective to be part of this discussion and deeper dive around how do we connect with a youth peer professional and who might be our best organizations to benefit from this.
So connecting with a youth peer professional, it really starts, your connection with them starts during the interview. You're immediately building rapport with this peer. When you're interviewing a peer, you're interviewing them, but guess what? That peer is interviewing you too. They're trying to determine if you're going to be a good leader, if you're going to be supportive, if you're going to respect them, if this is where they want to stay. So that first impression is really important too. And that's how you're going to start building that connection with that youth peer advocate, is immediately during rapport, setting that environment, setting the tone, being supportive and understanding and compassionate. So who can benefit from a youth peer advocate? A lot of youth can benefit from a youth peer advocate. They don't necessarily have to have a mental health disorder. They don't necessarily have to have experienced one of the adverse childhood experiences. They can just be a youth who could use some extra support, a youth who doesn't have a strong family support system, a youth who is struggling with a parent who is permanently disabled. There's many reasons why a youth could benefit from a YPA. So how can we gain more YPAs to our agency? How can we recruit them? That's really important, and that's something that comes up a lot. And I'm going to say the first thing is, when you put up a job posting, it has to be the appropriate pay. To be very honest, right now at Starbucks, I can get paid $16 an hour. But if I applied to my local youth peer advocate organization and they contract with other agencies and send YPAs around the community, right now their starting wage for YPAs is $14.75 an hour. I'll tell you, I'm going to take the job at Starbucks because I'm getting paid more and I'm not being pressured to do a high stress position. So when it comes to recruiting, we have to be setting the proper wage. We have to compete with fast food wages because we want people who are passionate, but also passion doesn't pay the bills, as I'm sure everyone here knows. And it's hard to know that, but it's true. So we need to have the proper wage listed. We also need to be posting our job listing on multiple platforms. Frequently, I'll only see it on the organization website, or I might see it on Indeed. But there are many, many more platforms. We can use LinkedIn. We want to utilize social medias. If your organization has a social media platform, such as Instagram or Facebook, post the job listings on there. You also want to be connected to your community event groups, community event organizations, things like that. Share that you have job listings in these event groups, letting other people know that this is an opportunity. So we've put our job listings out there. What's next? When we get an application, we want to follow up with that, of course. But we also want to consider, what are we competing against? Where else is this peer qualified to work? Because your position is not the only position they've applied to. So now you are not only competing with fast food wages, but you're also competing with the other organizations this person is qualified to work at. And if I have 5 years of experience as a youth peer advocate or working in the human services field as a general, I'm not taking an entry-level position as a youth peer advocate. I'll take a team lead position. I'll take a position as an entry level as long as I'm being paid an appropriate amount. So we have to take those things under consideration. Now, when it comes to retaining our peers, this is another thing that comes up a lot where, you know, supervisors and organizations feel like their peer department is a revolving door, as someone earlier said. You know, we have peers coming in, they stay for maybe a few months and then they leave, whether they gave us a 2-week notice or they abruptly resigned. And that's always really difficult to experience. One of the ways that we're going to avoid that and we're going to retain our staff is by having a trauma-informed approach to supervising them. We really have to take that under consideration. Last week, something that I mentioned was my experience with a supervisor who did not respect my trigger. Just to briefly clarify what that was, I had read a youth's case file. I had identified the trauma she experienced. Her trauma was extremely similar to my trauma. And even though I could read the case and I was okay, I knew that if she had a flashback, it would trigger my own because there are just way too many similarities. And I wasn't at a point in my healing journey where being exposed to her flashback would not trigger me, which maybe 5 years down the line, being exposed to her flashback wouldn't cause me to have my own, but unfortunately it did. And if my supervisor had taken a trauma-informed approach, she would have made sure that I was not left alone with this youth because I was the only support when she had an external flashback, to the point where she was vocalizing what she was experiencing and thought that I was the one abusing her. That was very difficult. Not only was that a trauma trigger for me, but now I'm the predator, you know, and that could have all been avoided if my supervisor had used a trauma-informed approach and was really taking that under consideration. So there's 6 key points to being a trauma-informed approach to supervision. We want to create an environment of safety that's secure, supportive, and consistent. So how can you do this as a supervisor? 1, we're going to acknowledge the triggers that our YPA might experience or have. We really need to honor those. We also want to understand what mental health symptoms they might experience. For example, I might not disclose to my supervisor I have PTSD, but I might tell her that, hey, I'm really struggling today. I'm having a lot of anxiety. I don't really feel all the way up to my usual work performance. I didn't say that I'm having a PTSD flashbacks all day and I'm just silently maintaining it. What I said is I'm experiencing distress that is impacting my work performance. So we really have to pay attention to the key words that are being expressed to us, because we might not be comfortable to outright say, I'm having flashbacks, I'm having an anxiety, something that this youth said triggered me. So we want to take it under consideration what is being expressed and what is behind, what feeling is behind those words. So the next point is being trustworthy and transparent. And again, this starts right during the interview. You're being honest about what is occurring. You're being honest about the position and the responsibilities. You're consistent. You don't change the responsibilities or give them new things right away. There's boundaries in your dynamic, and there's an openness for discussion. The next point is collaboration and neutrality. There's been a lot of discussion on how to collaborate with a youth peer advocate, so I'm going to continue moving forward. And then peer support. Allow this peer to engage in other peer activities in the community, in the state. Encourage that, support that. One of the things that they can do is join an advisory council, attend the monthly peer meetings that Families Together hosts. So the next we have empowerment and choice. And this is where we're going to support the YPA to self-advocacy skills. We're going to support their autonomy, and we're going to support the self-advocacy. And we can do this in a professional sense, which is where we need to do this. And in order to do that, we want to build up our YPA skills. We want to encourage them. We want to praise them. We want to acknowledge their strengths. And we also want to give them choice. If they are able to flex their schedule, we want to allow that. We want to give them that power and authority and independence. You know, YPAs do not need to be micromanaged. Some of them who are starting out their career and this is their first position as a YPA, they might need some more hand-holding. But if you take on a YPA who's got 6 months of experience, that's enough to have a pretty good idea about how they're going to be a peer and how they want to lead themselves. But you can still provide them that support, and they might need some extra support too. So remember, it's going to be individualized based on that peer. And then lastly, taking under consideration the cultural, historical, and gender complexities and how that can impact this peer. Something that I want to share is that in my immediate family growing up, there was one male who was relatively violent. When I was working at a residential setting, there was one male who was relatively violent. And it was very difficult for me to provide support to this youth in particular, because the behaviors that he displayed were the same types of behaviors that occurred in my household that I witnessed when I was a child growing up. So I needed my supervisor to take that under consideration in the fact that this male, who is a youth, is taller than me, muscular than me, has a different way of vocalizing himself, which was a very aggressive manner, and he engages in violent behavior. Now, as a YPA, I want to be able to support them. I want to build their skills. I want to increase their emotional regulation abilities. You know, I want to be able to support that. However, I couldn't do that when this youth was engaging in violent behavior. So it all goes back to taking all of these things under consideration, so that way we're providing a trauma-informed approach to supervising them. And
This
that's
is all really great, Meghann, too. And I think it's relevant across the board, right? Individual, adult, but it starts at that youth level if that's the experience. So I'm going to stop us now. We're a little over time, and I want to be respectful of all of our presenters and everyone in the audience with us today. Thank you so much for joining us. Thank you to my presenters, to those who have been listening contently. I popped in the chat. Please reach out to us. If you have any additional questions, feel free to email PeerTAC. They will get them to us. I just truly enjoyed our discussion this afternoon, and I hope you all did as well, and maybe learn something, have a little takeaway from this session today. So thank you all. And I hope you all have a wonderful weekend ahead. So thank you.